Welcome to Venable's program today. What's next for healthcare under the Biden administration and the 117th Congress? We're so glad you could join us in this first installment of our 2021 Venable Healthcare webinar series. More on the upcoming topics, which will include HIPAA, other federal and state privacy and security regimes, and payment matters facing the healthcare industry, and the dates for those installments will be shared at the end of our program today. I'm Tora Johnson and a partner in our healthcare group. I'm fortunate enough today to be joined by a couple of my legislative colleagues and friends. Yardley Polis Kimball is a partner in our legislative group. Yardley recently joined us from the Hill, where she served as the Chief of Staff to U.S. Congressman Bobby L. Rush. We're so excited to have her here at Venable. And Sarah Donovan, one of our senior policy advisors in our legislative group, who focuses on healthcare, education, and privacy matters, among other areas. Please submit questions to us today using the chat feature. We may save them to the end to get through all of our material today. And if we don't get a chance to answer any of your questions live, we'll follow up after the program. So we'll begin today with an overview of the Biden administration's healthcare priorities. We'll spend some time on Biden's immediate healthcare wins under the American Rescue Plan Act, or ARP, or ARPA. We haven't quite decided which is best. That became law in March, and in fact on March 11th. And then we'll examine some tools at President Biden's hands to accomplish his additional priorities. And then at the very end, we'll wrap up with some healthcare items of interest for employers. And you might ask why for employers? And that's because employer coverage is such a key mechanism for the delivery of healthcare in the United States. And with that, Yardley, will you begin with an overview of the Biden administration's priorities?
Thank you, Thora. Thank you for having me. Before I begin to speak about his priorities, Biden's administration's priorities, it's important that we understand the framework. The plan itself really sits on three pillars that we've identified, and that is one, access to quality healthcare, access to affordable healthcare, and also reducing healthcare disparities. So I'm going to highlight some parts of the access to quality healthcare that the proposals that are out there that we think Congress and the administration will definitely work on. One is strengthen the Children's Health Insurance Program, which is also known as the CHIP program. The CHIP right now is really undergoing what I call a 5-year periodic reauthorization, usually every 5 years. So there's a push in the Congress and the administration to give that program, the CHIP program, permanent authorization. And so there's at least more security into the program. Also, we're going to see issues delving into Medicaid and Medicare parity. So the Biden administration is all about access to healthcare, making sure the vulnerables are covered, and having Medicaid reimbursement payment align with primary care issues with Medicare is a great concern to them. You'll also see advertising and marketing outreach for the ACA open enrollment. Many individuals are still not aware about the ACA, so there's a push for advertising in that arena. Also, there'll be some shoring up, enhancing the ACA plans. They'll be dealing with quantitative network adequacy. And one more issue, I don't want to go through all of them. One would be that's really of concern to the Biden administration, but more so in Congress, is dealing with what I call short-term limited duration insurance plans. And some have called them junk insurance, but these are plans that really are not covering essential services for consumers. And so there is a push in the Congress to either address these issues or eliminate the plans itself. Next slide, if you don't mind, Dora. So now in terms of affordability of healthcare that I kind of mentioned, one of the pillars, you cannot have affordable healthcare without also addressing prescription drugs. So I will deal with that a little bit later, but we'll see issues dealing with price transparency, how to control Medicare spending, especially the Part D program that's been out of control in terms of spending. We'll see issues dealing with anti-competitive healthcare consolidation. There's an increased mergers that we're seeing with medical practices and hospitals. There'll be issues dealing with site neutral payments. And basically what it is for the government to pay the same medical service rate that for outpatient services, or if the services are performed either in an outpatient hospital or at an independent care doctor's office. There's also a need for the HHS secretary to negotiate drug prices with manufacturers. Having generic and biosimilar drug manufacturers enter into the market. So they believe that if generics and biosimilar drugs are competitive, that would also lower prescription drug prices. And there's also a big issue that I'd say that I also think that has bipartisan support in the Congress and that the Biden administration will address is the anti-competitive behaviors dealing with patents that drug manufacturers have been, what they would say is they're gaming the system. So if they have a drug, perhaps they'll issue lots of patent tickets so they can deny entry for other drugs into the market, or some will perhaps delay or sample delays or sample denials for the generics, or even some drug manufacturers and generics themselves are entering to what we call pay for delay settlements. And so all of these are gamesmanship into the patent system in the drug arena. Next slide, please. Now, not too long ago, I think, was it last week? Everything is a blur now with COVID, but the Biden administration did bring to the Congress its $1.5 million spending priorities. And a lot of this is basically top line. This is for their fiscal year 2022. And so what we are seeing, no, I'm sorry. I think I'm going a little too fast here. Hold on for a second. No, I'm right. I'm sorry about that. So we saw the fiscal year 2022 discretionary spending. And what that is proposals to the Congress about the top line issues that the Biden administration will care about. And these are basically, like I mentioned, discretionary. They don't deal with what I call entitlement programs, such as Medicaid and Medicare. So we're seeing 3 areas that the Biden administration is focusing on. One is to strengthen the public healthcare infrastructure. Lots of dollars are going in for CDC, to modernize the public health infrastructure, for data collection. You're also seeing dollars going to help the global health programs. And definitely the most important one, I would say also is shoring up our strategic national stockpile. Next slide, please. In another area of Biden's priorities, there's a concerted effort to address other diseases and epidemics. So making sure that NIH has the necessary funding that they need to conduct research. And these research will be in cancer, diabetes, Alzheimer's, addressing the opioid crisis. And also a big issue is allowing CDC to address gun violence and treating gun violence as a public health crisis. Next, please. And then the last pillar, I kind of mentioned it earlier, that there were 3 pillars. One is to address racial disparities in healthcare. And so there's focus on money to CDC to work on achieving health equity and data collection for racial and ethnic populations. There are dollars going into reducing maternal mortality and mobility rates, and also to address the inequities that American Indians and Native Americans have faced. Thank you. And not too long ago, and I think Thor mentioned it, in March, we did pass in the Congress the American Rescue Plan. And I only bring this up because I wanted to at least provide everyone some highlights about what was passed already. because the Biden administration is going to build on the American Rescue Plan. So the American Rescue Plan really is the first piece of legislation, I would say, that came out of the Congress to really address ACA or enhance the ACA. So it's been a decade since the American Care Act was introduced in 2010, enacted into law. And we haven't really revised or made changes to the ACA. And so the American Rescue Plan really takes the first step in doing that. So a couple of things that it did, it expanded the ACA's tax subsidies. For example, it enhanced marketplace premiums subsidies to all income levels. So what you did see, that income that were perhaps above 400% of poverty rate were now included into these. It also provided a tax credit holiday, and also 100% what I call full coverage COBRA subsidies for individuals who had a qualifying life event, such as they were laid off or a reduction in workforce and work hours.
Hey, Yardley, on the increase in the premium subsidies on the exchanges, it's a good thing to also note that during the Trump administration, the open enrollment period on the federal exchanges was carved back to 6 weeks, which is about half of what it used to be under the Obama administration. Okay. And one of the first things President Biden did was sign an executive order that directed the Department of Health and Human Services to consider reopening open enrollment on the exchanges. And HHS did that. And now the upshot is, in that about 3 dozen states, healthcare.gov is open for 3 additional months from February 15th to May 15th. And some states have actually extended that, including Maryland, through August 15th. And I only raise it because that's significant that there's an opportunity to actually get those increased premium subsidies by having this new special enrollment period through May 15th, and in some states through August 15th.
No, absolutely. You're absolutely right. And there's also, I don't know if you've seen a lot of commercials and ad allowing individuals to know about the open enrollment. And this is called what they call the Navigators Program. And so absolutely. Thank you. Oh, one more thing on the COBRA before we go. I think it's providing full coverage up to 6 months. So it's from April to September of this year.
That's exactly right. And on that one, that's important for employers to know that they are able to claim. So they might have to front the premiums, but then the employers can claim that as a credit on their payroll taxes. And as you noted, it's for the involuntarily terminated from April 1 through the end of September.
Absolutely. Next slide, please. It also, I don't know if we're calling ARPA or ARP, but the recovery plan also provided fiscal incentive for states to expand Medicaid. So currently, there are, I believe, 12 states who haven't yet expanded into Medicaid. So there's an incentive there to increase their FMAP. This is the federal medical assistance percentage to 5 points, just of an attempt to wooing them into the program, because the key for the Biden administration is to make sure that the vulnerables are covered. Also, it would allow states to extend Medicaid coverage for postpartum women to a full year. I mean, right now it's 60 months that they're covering, and it will go from 60 months to a full year. And really the rationale behind this is really to address infant mortality and maternal health care. Many women face a coverage cliff that they call in states that have not expanded Medicaid to 60 days. Next. Oh, I think I'm done. I went a little too fast, I believe. Sarah.
That's all right. I'll call on you, Yardley. So I'll build on what Yardley said and talk about what are some potential vehicles or other tools that the Biden administration and with the Congress could use to further advance the healthcare objectives that Yardley's laid out for us. One is the American Jobs Plan, which was released by the Biden administration, that we're kind of thinking about as part one of two proposals that are part of this. I'm going to say, infrastructure, even though we're defining infrastructure in this case quite broadly. So American Jobs Plan was part one, and we're looking at, what they call it changes by the day. Right now, I think it's the American Family Plan, but we're calling it the American Healthcare and Family Plan because we're anticipating that it will contain meaningful healthcare proposals as well. So those two together we'll talk about as the Biden Infrastructure Plan. And then I'll talk a little bit about budget reconciliation in that process, because at this point, it's a very likely vehicle for one or both of these plans to travel through the Congress. We're going to talk a little bit about these American, dealing with American competitiveness. They're being referred to both in the press and in Congress as, a China bill or the China bills, but really they're dealing with competitiveness on a global scale and counteracting some of the measures that China as a nation state is utilizing that really harm the American economy and the American people. We're going to talk a little bit about regular order appropriations, so fiscal year 22. And then we're also going to talk a little bit about executive actions, agency actions, including rulemakings, and Tora will cover that at the end when she's talking about other issues that are going to be key issues for employers. So let's talk a little bit about the Biden infrastructure plan and the potential process it could use. As I mentioned, President Biden has put forward this American Jobs Plan, and then he's indicated that this family plan, this health plan is going to follow. And we're not sure when exactly that's going to be, but we think that it'll be this spring, certainly. And it could be, it could be anytime from very soon to, give it a little bit of time. They're still in the process of collecting ideas and deciding how they're going to put these priorities into, turn them into proposals. I have to say, this is, I don't want to be a doomsdayer here, but unless it's scaled down or otherwise significantly modified, what we've been hearing directly from members of Congress in the Republican Party is that they don't really intend to support this effort in a meaningful way. That doesn't mean that they're not hearing the president out. And certainly the president has been, and his designees have been doing outreach to Republican members of Congress. Just yesterday afternoon, he invited a bipartisan group of members, both from the House and the Senate, to the White House to talk about one part of the plan. This was the more traditional infrastructure piece, roads and bridges, that sort of thing. Even though we heard from members that were there, that we spoke with after the meeting, that they did get into other issues like broadband and things that were part of that proposal. But there's certainly outreach. The White House will probably continue to do these sorts of meetings on various pieces of the plan to try to get bipartisan buy-in. But I think it will be very difficult for the Republicans, as a whole, to support it, just given the size. And that's really what it's going to come down to, is the price tag here. So therefore, likely Democrats will, go at this alone, and then budget reconciliation, because of the way that it's structured, really becomes a natural tool for them to use for this. So let's talk a little bit about what is budget reconciliation and why it's important. I think we all got a little bit of a primer with this under the American Rescue Plan. We saw it play out in real time. I don't know that many Americans really knew what a vote-a-rama was before. Maybe they still don't. But we had a review because it has been used multiple times in the past by both parties for bills. So, for instance, the Bush tax cuts, both rounds of used this. The American the Tax Cuts and Jobs Act was also used by Republicans. They used budget reconciliation. Democrats used budget reconciliation in the past to make revisions to the ACA, like Yardley talked about 10 years ago. This is because they had to kind of quickly hurry up and pass it because of the passing of Senator Kennedy, but then they needed to make changes to it. So they went back and made revisions kind of almost immediately to it. So it's been a tool of the majority for, quite some time. And in this polarized, especially Senate environment, it really is the primary tool of the majority to enact, things that are important to them. So let's do a little bit of a rewind and just quickly go through process. House rules only require a simple majority to pass legislation, but in the Senate, you have to have 60 votes for most pieces of legislation. And under current Senate rules and precedent, the minority party can filibuster bills or hold them up if they don't support cloture, which is when they end the filibuster. So therefore, budget reconciliation provides a process to pass certain legislation by a simple majority similar to the House. And like I mentioned before, it's currently the primary tool to circumvent the 60 vote threshold, and that's in the absence of doing away with the filibuster, which obviously has gotten a lot of media coverage. But I think at this point, we're a little bit skeptical that that could happen given some of the positions of the more moderate Democratic senators. So I used to say that budget reconciliation could be used once a fiscal year, but they may no longer be true because Majority Leader Schumer has asked the Senate parliamentarian to review and decide whether or not it can be reopened or it can be revised and basically used more than once a fiscal year. We haven't seen the results of what she said, but Leader Schumer has said that she has given the path for that to be the case. And staff have, in both parties have seen it, although it hasn't been released. So I think, right now they're probably deciding, Schumer and others are deciding how exactly they wish to proceed with this new information that they have. So as Yardley mentioned, Congress used the fiscal year 21 budget resolution to enact COVID relief. This is the ARP that we've talked about a few times. And so obviously fiscal year 22, which is our current fiscal year, is available. And there's also going to be a third fiscal year 23 that will be available before the midterms. But, depending on what this parliamentarian ruling shows us, there may be additional bites of the apple. And so we'll just have to see. I think one thing that I would note is that budget reconciliation rules are more stringent, they're stricter in the Senate than they are in the House. So you'll see the House, and this played out during the COVID relief bills too. The House is going to kind of pass what they want. They're going to put it in there, and they're going to send it over to the Senate to parse through and decide what it is can make it through both the process and the party. And this is probably also a good time to note that the margins, we haven't really talked politics within the Democratic Party, but the margins are so razor thin in both the House and the Senate. In the Senate, obviously, they're evenly split. So it's 50-50 with Vice President Harris being the tie-breaking vote when needed. And so that means that in order to utilize budget reconciliation, Senate Democrats have to have, when I say every member, I mean every single member on board with this piece, with this legislation in order to pass it. And in the House, actually, it's quite thin too because of some nominations that President Biden has made. There's been some shifting around. I think it's down to 3. The Speaker can only lose 3 members of her party in the House to vote against anything. And so, look, I think we all by now know that she is masterful at keeping her caucus together. And we anticipate that she will continue to do that. But it just means that she's got to get everyone from your AOC all the way to your Democrats that want a Trump district, all bought in, just like in the Senate, to the same package, the same piece of legislation. So there's just no margin for error when it comes to keeping the caucuses together. This is basically, I don't want to spend too much time on this, but this goes through the limitations that the Senate has in terms of what will pass the test, the Byrd rule tests for budget reconciliation. So it's not everything. Generally, we can say that budget reconciliation is for government spending, and then it's also for raising revenue. So it's like taxes and spending. Those are the 2 big buckets that they look at when they're talking about budget reconciliation. And actually, healthcare falls in quite neatly with this. So as opposed to your more traditional infrastructure like highway trust fund issues, that was a little more tricky to use budget reconciliation for. But for our purposes here today, healthcare has absolutely been used, has moved through budget reconciliation before, and it will again. I'm doing a lot of talking, Yardley, so feel free to jump in.
Now, before you go to your next slide, I just want to chime in on the politics too. And sometimes we get stuck with the policy, and we have to figure out, is it the politics that's driving the policy, or is it the policy that's driving the politics? And it's hard to tell sometimes. And again, many of you have heard, I'm fresh off the Hill, but just be mindful that in the House, the midterms are coming. There's pressure to deliver, especially on the healthcare front. So, and as you said, I'm agreeing with you, Sarah, that we can't afford, or any side really can't afford to lose a member. It's really going to be difficult on issues dealing with healthcare if, let's say, it goes to the route of the AOC in terms of public option, all the things that, changing the Medicare eligibility age. I'm not sure if some of these issues will be addressed because the margins are so thin. But I don't know. I just wanted to chime in before you go into the next slide. Go ahead.
Thank you. So let's talk a little bit about these very sort of awkwardly named China bills. I'm going to call it American competitiveness legislation. And I toyed around with, how do you talk about these things? Because, the language that they use on the Hill is often its own vernacular. So Senate Majority Leader Schumer is really spearheading this China legislation. And last Congress, he had a bill that he and Senator Young from Indiana had co-sponsored together. And so the two of them are really the leaders for each one of the parties in the Senate that are talking about this legislation and the need to make a substantial push to counteract the harmful practices that China has been undertaking. They're going to be looking at American investment in American innovation, protecting American workers and jobs and manufacturing, and using strategic partners across the globe, including allies, to expose and end some of these anti-competitive practices. Leader Schumer has instructed the Senate committees to begin work on this. He did this, I want to say, last month. And so we could see a lot of work on this, continuing these work periods. I know that they were working on it during this April work period that they had the past 2 weeks, and they're continuing to work on it. And this includes the Health Committee in the Senate, the Health Committee. And they're looking at some ideas right now that include how to improve research integrity and foreign interference in that, supply chain, genomic sequencing. So this will be everything from, PPE to lab work. And this could move alone, or it could be part of this infrastructure effort. We're not really sure. This is kind of, the ideas are swirling and the committees are hard at work.
And just before we go to the next slide, for those who are wanting CLE credit, the password is Healthcare 101.
So we'll talk a little bit now about fiscal year 22 appropriations. This is kind of a moving target too, because depending on what the ruling is of the parliamentarian that we haven't seen, and the path that Majority Leader Schumer decides to take with this could be hung up, or they could continue forward with this. So we're going to talk about it as if it moves forward, but know that things are a little bit up in the air when it comes to fiscal year 22 appropriations right now. And the reason is because if the parliamentarian does, say that there can be revisions to the budget reconciliation for fiscal year 21, you can't very well move along to 22 if 21 is still open. So our annual appropriations process has always been a vehicle for healthcare policy and funding. There's a lot of things that you can do with the annual appropriations process. You can have report language, you can have new programs, you can have funding increases and decreases, and some areas that we're sort of guessing because this process is underway right now. Where could some bipartisan areas of agreement be for fiscal year 22 healthcare increases be? Well, it could be, like Yardley mentioned, dealing with the opioid crisis, maybe mental health, because that has really come into focus, especially children's mental health. and perhaps NIH funding. There's some other things, maybe CDC. It really kind of depends on how this all comes together, but there could be some areas of bipartisan agreement in the appropriations process as well. Yardley, do you want to take maybe the House players, and I'll take it over from you and do the Senate?
Absolutely. So these are the players that we know will have at least a touch on many of these proposals and legislation. On the House Energy and Commerce, you have Chairman Pallone, you have Ranking Member Kathy McMorris. On Subcommittee on Health, you have Anna Eshoo, and which is the chairwoman, and also Brett Guthrie from Kentucky, who is the ranking member. You also have on the Ways and Means side, which is more so your tax provisions, you'll have Chairman Richard Neal and Ranking Member Kevin Brady. So they'll all play a role. And not to mention, of course, the Appropriations Committee, which you touched upon, Sarah, earlier, that, you know, that's in terms of the fiscal year 2022 discretionary spending. You have Chairwoman Rosa DeLauro, who is in charge of the subcommittee. Well, she's in charge of the whole committee, but definitely Labor HHS subcommittee is a particular issue of hers. And also Member Kay Granger from Texas will play an important role there, and Tom Cole also. So these are the players that we see on the House side that will definitely have input into these proposals. Mm-hmm.
And then on the Senate, there's some new faces and some familiar faces both here. We have on Senate Finance, which is the counterpart to the Ways and Means. You have Chairman Wyden, and Senator Mike Crapo is new to this role because of the term limits that the Republican conference has imposed upon itself. These are not new, but you can only serve 6 years as a ranking member or chairman. So they tend to move around a little bit more than on the Democratic side. And on Senate Health, Chairwoman Patty Murray, she's long been the top Democrat on the Senate Health Committee. She also serves as chairwoman of the Labor H subcommittee on appropriations. And then after the retirement of Lamar Alexander after the last Congress, Richard Burr has moved up as the ranking member on Senate Health to be Chairwoman Murray's counterpart. So on approps, there's some very familiar faces here. Pat Leahy is the chairman. He was previously the ranking member. And then he also did the flip-flop with Richard Shelby as the ranking member there. So those two have worked together for quite a long time. And then same thing, we have Senator Murray and Senator Blunt returning as top Democrat and Republican, respectively, on the Labor H subcommittee for appropriations.
Great. And now it is back to me. And again, as I said at the top of the hour, I mean, one of the important pathways to healthcare in the US remains employer coverage, group health plans. And so I wanted to tick through pretty briefly a long list and then of Biden administration priorities and some of the tools that Sarah mentioned that have been used and may be used to drive change. The big one, the big picture, right, is COVID-19, and the Biden administration is very focused on testing, tracking, and the vaccine program so that people remain healthy and it's safe to reopen and welcome individuals back to places of work that have been shuttered during the pandemic. But under the radar, just as an example of agency guidance that's relatively recent, the IRS announced that amounts paid for personal protective equipment, PPE, including masks and hand sanitizer, that are purchased for the primary purpose of preventing the spread of COVID, can be treated as amounts paid for medical care, and as such can be reimbursed from medical FSAs, HRAs, and HSAs. Plan documents do need to be amended to provide such. Then Yardley discussed the COBRA subsidies that were part of ARP, And again, no cost COBRA premiums for former employees who were or are involuntarily terminated or their hours are reduced from April 1 to September 30th. Employers may have to front the costs of those premiums, but get to take it on the back end off their payroll taxes. There's relatively new guidance out there on the administration of those COBRA subsidies and the need to send updated notices to a certain subsection of former employees. So it is not a dull time in the employee benefits arena. I also think that telehealth is here to stay. We definitely saw a huge shift from in-person to telehealth visits during the pandemic. I expect to see more of that and have it continued in both Medicare and the employer health plan market by, for example, relaxation of licensure rules for providers. So providers can see patients not only and with the relaxing of licensure rules. Usually you have to be licensed in the state where the patient is, but some relaxation of those rules to get care where care needs to be delivered and can be delivered efficiently through telehealth. And then Yardley did spend a good time talking about the shoring up of the Affordable Care Act, but we do expect to see additional action there. We talked about the extended open enrollment period. I do think that it'll be interesting to see with the increase in those who are eligible for a subsidy, what will happen to the employer mandate under certain circumstances. If an employee obtains a subsidy on an exchange, it can trigger a penalty for large employers, which are employers with more than 50 full-time employees. I also think, and we haven't mentioned it yet because it's really at the hands of the Supreme Court, but there is an important case before the Supreme Court that oral arguments were held last November. And the issue is whether the individual health insurance mandate is still constitutional after Congress reduced that penalty tax for failing to obtain health coverage to $0. Congress has used its taxing power to pass the ACA originally. And so the argument is, if there is no tax, can there be a mandate? And then next, if the mandate's unconstitutional, could you bring down the entire Affordable Care Act, or is that provision severable? And what is of interest here is that on February 10th, the Department of Justice, under the new Biden administration, submitted a letter confirming that the administration is switching positions from the old administration to state that it's requesting that the entire ACA be upheld. So stay tuned. It's likely that we'll see a decision in the coming months. Yardley also spoke about short-term health plans. So they typically have lower premiums, but provide far less comprehensive coverage. And in fact, they don't provide all the ACA required protections for people with pre-existing conditions, et cetera. And there's a real divide out there whether some coverage at a less expensive rate is its saving grace or its downfall. Under the Obama administration, an individual could remain covered for only 3 months. Under the Trump administration, that was extended to a year, and then you could renew the policies for up to 3 years. And sometimes they were used as an alternative to employer coverage. President Biden has signed an executive order that directs federal agencies to reconsider this rule and maybe carve back the amount of months one can be covered by it, or maybe we'll see it completely eliminated, this practice of short-term health plans. Then the other crystal ball gazing, I think that we will see the Section 1557 protections for transgender to see new life. So the Trump administration struck down a Obama administration regulations prohibiting discrimination in healthcare against patients who are transgender. A federal court actually blocked the repeal, and the Biden administration very early on stated that it would, quote, defend the rights of all people, regardless of gender, sexual orientation, gender identity, to have access to quality, affordable health care free from discrimination. So those pillars that Yardley started our conversation off with. So I do think that they'll reissue 1557 rules that provide for protection. I do think it's a good time for employers to look at their health plan coverage and reevaluate whether they are providing coverage related to gender transition services and if any changes need to be made. Also, there are EEOC rules on wellness initiatives and the incentives one can pay employees for partaking in wellness programs. They were finalized at the end of the Trump administration and actually published in the Federal Register, but they've been withdrawn and are being reviewed. In the meantime, there are companion regulations under HIPAA non-discrimination rules that are still in effect, but it'll be interesting to see what new rules we might see out of the EEOC. And then there's a whole host of regulations that I think we'll see stay in place, that some of them have their roots back to the Obama administration under the 21st Century Cures Act that passed, I think, in the December, his final December in office, and have been augmented with some of Trump's regulations. So we'll see a continued shift from fee-for-service in the healthcare industry to value-based care. We'll see a push to price transparency in healthcare. Not only must hospitals now post pricing on their websites, health plans in the very near future will be required to maintain a list of costs for coverage and certain items under health plans, all at arming individuals with costs so they can be informed consumers of healthcare. And along with that, a push to the interoperability of medical records. So have various electronic health records speak to each other, have insurance carriers move records from one insurance company to another insurance company that follows the individual, and the individual having a real right to access their medical record, putting the individual in the center of their care. So arming the individual with cost information and with their records so that their records travel with them from provider to provider, and in some cases, insurance company to insurance company. And to make that really happen, I think we'll see new final HIPAA regulations. There were proposed changes to the HIPAA regulations at the end of last year that made it into the Federal Register. The comment period, I think, is still open on them, but align most of HIPAA uses and disclosures are permissive, but to really get to interoperability, they need to be more of the required nature. So I think we'll see some smoothing in that area in the HIPAA regulations. And then Yardley also talked about lower drug pricing. We'll see, as part of the omnibus spending bill that was signed into the law at the end of last December under Trump, included provisions that were aimed at curbing surprise billing by out-of-network providers. I think we'll see regulations in the near future to help implement that surprise billing prohibition. Again, very bipartisan. Also, Yardley mentioned, or Sarah, I can't remember, parity for mental health and the push to provide robust mental health. And I think that will be a real focus of enforcement under the Biden administration. And in fact, in that same bill that was passed last December, that included the provisions on prohibiting surprise billing, there is a new law tucked in there that requires employers to have a written document that talks about non-quantitative treatment limitations that they have that apply to mental health and substance abuse and to regular medical surgical benefits, and making sure that they're not applied more stringently on the mental health substance abuse side. And there's a requirement to be able to produce that document to the government. It's not new law. There's always been a requirement for the last umpteen years to have parity in mental health and medical surgical benefits, but this is putting some more teeth behind it. So I do think that we are going to see just a lot more guidance continuing to apply to employer health plans, which I have said just remains a very key component for the delivery of healthcare in the U.S. And Yardley, I don't know if you want to say anything at this point. I'm going to put you on the spot on a public health option, but maybe this would be, maybe we could devote a few minutes to that.
I think that's going to require a webinar all into itself.
I'm sure that's true. I'm sure that's true.
I mean, I know everyone's wondering, are we going to have a public option or not? Is it going to be Medicare for all? Is it going to be a single payer? To be honest and frank, we don't know. We do know that President Biden, especially during the campaign, he mentioned that he supported a public option. And so this is floating on the Hill. There are some bills and proposals out there already, but I cannot say concretely whether we will see it or not. I think there'll be some form of it, but I can't say whether we're going to see what I call a strict Medicare for all proposal out there. I don't know if you think the same, Sarah, but that's what I'm getting right now, just because of the political issue that's surrounding it at this point.
No, that makes perfect sense, and we can think about a webinar all of its own. And Yardley, one more question for you. You didn't mention anything about the 340B drug pricing program in the U.S. that requires drug manufacturers to provide outpatient drugs to certain eligible healthcare organizations at a reduced price. Do you think that there'll be any reform on the 340B program?
First, I apologize. I realized my computer was out of power. So sorry if you saw me duck here. I know I didn't address it. There's so many things you can address with healthcare. The only thing I can say that I do see with 340B, I do see, I don't see the structure of the program changing with the Biden administration. I think that you will see much more oversight of the program. I think that, well, first of all, let me backtrack. What is 340B for those who do not know? It's a discounted drug program. It was created in 92, I think it's 92, okay. Right after the Medicaid drug rebate program. And following that, I remember that. And so what it allowed drug manufacturers to provide discounted drugs to covered entities. And what are those? Those are your DSH hospitals, disproportionate share hospitals, your FQHCs, which is your federally qualified community health centers, your children's hospitals. So they get these discounted drugs. So over time, there's been some arguments, especially from Republicans. I have seen many years talk about that the program has expanded, right? In terms of they're more now what they call contracted pharmacies. So there is issue again to address and have oversight over the program, but I don't see any issues dealing with restricting the program or curtailing it, because that program is so essential for those safety net hospitals. And I just don't see the Biden administration doing too much with it, but just preserving it, I would say. I guess that's my short end story for this one. Thank you.
Really helpful. I'm going to ask one other question that we got from the audience, which I'm sure there's no easy answer to, which is the likelihood of the Medicare eligibility age being lowered.
I think I had addressed that. There are some proposals to have that lowered. I think 55 is the number I'm hearing. But again, that's not concrete. It's really a proposal that's out there. I'm not seeing a lot of buy-in in the Congress for this issue. But in terms of the left wing of the party, of the Democratic Party, that's a big push. I think Senator Biden is not Biden. I'm sorry, Senator Bernie Sanders is a proposal that he has out there.
That's great. Sarah and Yardley, before I close the program, any parting words?
Well, the parting words, I think that we need to do more of this, perhaps narrow it down to an issue or two, because like I said, healthcare is so broad and it can go on and on. There's so much to discuss, but I look forward to doing more of these. Thank you.
And that's wonderful because you have teed it up quite nicely. We do have an upcoming series of webinar topics and dates that you can see on the slide here, including breach laws, and then health tech generally, and the marriage of patient apps and price transparency and payment options, and then health information and FTC and state law regimes, and then use and disclosure rules under HIPAA Part 2 and interoperability rules. And it does feel like we're in an inflection point here in the delivery mechanisms, payment of healthcare, and are excited to be on that journey. A recording of today's session will be available shortly on our website. In the meantime, if you have any questions for Yardley, Sarah, or me, feel free to contact us. And I want to wholeheartedly and warmly thank Yardley and Sarah for joining me today, and thank the audience, and hope everybody enjoys the remainder of their day. Thank you.